anything with Steve. But I told him I'm not a limelight person, so you can have at it. But Steve and I got together to really put together this program because we see the true value that aging life care managers bring to so many of us who serve the aging population. So for those of you who don't know me, my name is Donna Fuller, and I am the Director of Outreach for Ingleside at Rock Creek in Northwest DC, as well as Ingleside at King Farm in Rockville. Ingleside is a small family of not-for-profit life plan communities, otherwise known as continuing care retirement communities. And we've been in the DC metro area since the early 60s, and we've been serving seniors for a very, very long time. We are so excited to, again, be a part of this program and to introduce you to some of our most valuable aging life care managers. So
awesome.
Look forward. Thank you, Steve.
Yeah, this is great. So I'm glad to have another voice, and this is something that hopefully you'll see throughout the next months is, co-hosts, maybe I'll just give up the hosting and turn it over to some other folks. But I feel like I'm kind of overexposed on this channel here. But in any event, let me run through a few housekeeping items before we bring our panel on. First off, this month, our sponsor is Raz Mobility. If you didn't see our discussion with this product, it's pretty interesting. It's a smartphone that is very, they have stripped everything off it so that basically somebody with cognitive impairment or dementia can navigate this phone. And it's a great way for families to stay in touch with a loved one. And we're excited. I'll put a link in chat later on with this product, but definitely check it out. Another thing is to just sort of tell you how to sort of make your experience the best it can be on this platform. First is, as I can see, where we got Mark Ash from Right at Home, who just made a posting there. Great example. What you can do is introduce yourself in chat. Think of it like a business card exchange. Very important, just like Mark Ash, make sure that you use the drop-down menu to that says all panelists and attendees. And Melanie Dans from Summerford Place, I just reposted your introduction there so everybody can see who you are. Secondly, we really want this to be an interactive conversation. The analogy that I've drawn is that I kind of look at this as, I want this to be a little bit sort of like the View TV show, where you have just a group of aging life care managers sitting around chatting, and we're feeding the conversation. And so we hope that you ask a lot of questions or make comments today. You can do that one of two ways. You can type those questions in, or when we get to a point where we're fielding questions, if you don't want to type something in, just raise your virtual hand and we'll bring you on. Don't worry, we won't ask you to turn your camera on unless you absolutely want to. The other thing, especially since we're going to have multiple people on the screen, is that you might like to toggle between speaker view and gallery view. Gallery view, everybody's equal on the screen. Speaker view, the person who's talking will dominate the screen. So when you have 2 or 3 people, sometimes speaker view is a good way to look at it. Just a reminder, proaging.com is where you can find a lot of resources, including recordings of our previous discussions and a calendar of what's going on. If you scroll down to the bottom, you can see the digital editions of Sourcebook, but you can also order copies. And we got a new Maryland edition coming out here in just a couple of weeks. I want to, before we jump into this theme, which I credit to, give a lot of credit to Donna, because it was a discussion that we had that led to us putting this together with aging life care managers. We're carrying it through for a couple of other professions too. So this month, you're going to get to meet some senior move managers and moving professionals on February 19th. And then on February 26th, you're going to get to meet some elder law attorneys. And what we figure is we're going to do this each month so that at the end of this year, you will have met over 50 care managers, elder law attorneys, and move managers. So we're hoping that, given that it's hard for us to get out and network like we used to, that this is a great way to meet some folks that you didn't know and understand their profession a little bit better. Now, I promise I'm going to get things started here, but this week we've got 2 other really good programs. Tomorrow we've got an entrepreneur, Melissa Ellison, who founded Better Now Health. It's a virtual therapy platform, but it's a little bit different than your traditional talk therapy. And she's going to talk about sleep care and the benefit and the program that they have to help people with sleep care. And then on Friday, this is one that I know everybody's going to want to tune in for. If you haven't heard Howard Gleckman speak, he's a public policy expert, nationally renowned, and really follows aging policy very closely. He's going to share his thoughts on aging policy in the Biden administration. So that's one that I know is going to really be thought-provoking and interesting. So hope to see you Thursday and Friday as well. And that sort of leads us to our bringing our panel on here. So let me ask our panel members to come on board. And there we go. We got them all, Donna. Wow, we're just moving in this digital world. We're moving. You know, think about it. If we did this as a live discussion, how long it would take them to walk up on the stage. Boom, we did it. There's some benefit to this virtual world.
Absolutely.
So sort of the format of today, what we thought we would do is just first start off, let's get to know our panel members. Then let's learn a little bit about the association. Then they're going to share some of their thoughts and insights. And you know, if I had to sort of wave a magic wand, what I'd love is that we do a half hour of kind of learning about the care managers and who they are. And the other half hour is open to all of your questions and feedback. And so just be thinking about, you got an opportunity. It's very rare. You're in a room with 3 aging life care managers serving different geographic regions, operating different practices. So think about all the questions that you got for these folks. So with that, I'm going to jump in and let's get to know Ellen Platt. And Ellen, if you tune into our discussions, is somebody that you might know pretty well now because her firm, the Option Group, sponsored our January discussions because it's her 10th anniversary. So congratulations, Ellen, again. And for those that haven't met you, tell us a little bit about your background and what led you to move into the space of aging life care and starting your firm.
Yeah, well, thank you, Steve. I appreciate coming here today and having us here, and I'm thrilled to be on with my colleagues. We are all certified through the national organization, Aging Life Care Association, and we are at the Option Group have hit our 10-year anniversary. So we have nurses and social workers, rehabilitation counselors, and case managers who help people navigate longevity, whatever that means for them. It may be staying at home, it may be going into facilities. We kind of look at them individually and come up with a comprehensive care plan to help them, support them as they age. And so I'm excited to be here with everybody and looking forward to the talk today.
All right. Good. Thank you, Ellen. Yeah.
Wonderful.
Yeah.
Should we introduce our next care manager, Steve?
Yeah, absolutely.
Wonderful. So I'm happy to introduce Christine Bitzer, who's the Assistant Director of Care Management for Seabury. So Christine, would you tell us a little bit about yourself and Seabury, please?
Sure. So as Ellen said, I want to reiterate, just thank you all for inviting me, and I'm privileged to be here with all of you. So I'm actually a social worker, and our program Monica Miklas is our founding director, and she took a little hiatus to raise her children, and now she's back with us. I guess she's passing about 6 years with us. We are a care management group that are all made up of social workers. One of the things that attracted me to Seabury, and I think attracts all of our care managers to Seabury, is that Monica has really instilled the idea of helping our clients maintain quality of life. And again, by going second, I get to kind of reiterate what Ellen said, but it's really looking at the individual, understanding who they are. And in fact, that was one thing that we're going to talk a little bit more about later. But as an intern, when I first heard about care management, I thought, oh my goodness, I can really develop a relationship with a client. I can get to know who they are, not just the challenges, not just the problems that they're facing. They're not their medical diagnosis, but what makes them tick. And how can I enhance that? How can I help them kind of solve some of these challenges, but then also bring back that person that was there. And that's one thing that I think all of our care managers really look to, because we are a part of a larger nonprofit. That's also really nice, because we're looking for kind of what are those affordable services out there? How can we be individualized, but also how can we be affordable? And we do serve clients throughout DC, Maryland, and into Virginia. So some of you may recognize me from Virginia, and others of you may recognize me from DC and Maryland. So thank you.
Great.
Thank you.
And one of the things that we're trying to do with this panel is that I think is really cool is that even though these are all aging life care managers, they're a little bit different, as you kind of heard. You know, Seabury is a nonprofit, and Ellen is based up in Baltimore and serves up to the Philadelphia region, you know, and Heather, who we're going to meet next, is based in Virginia. So Heather, tell us a little bit about your journey to becoming an aging life care manager.
Sure, thanks, Steve. Well, I'm Heather Suri, and I founded a practice called Pathways in Aging, and I serve Northern Virginia. I am a nurse by training, and I have a small practice. You know, I've always worked in the community-based nursing is my background. I had a certification in hospice and palliative care. So I love working with families in end of life. I love working with clients who have a lot of medical complexity. Those are things that get me very excited in solving problems and helping families navigate all of the options and resources through that. So that's what I do.
Excellent. All right. So now let's, before we kind of jump into you guys sharing some insights and tips and things of that nature, let's jump in to a little bit about the Aging Life Care Association. And one of the reasons that we've got Heather on this very first discussion is because she is the new president of the Mid-Atlantic chapter. So let's see, Heather, I've got that PowerPoint that you shared with me here that I can bring up. But if you want to tell a little bit about the association and how that works.
Absolutely. So the Aging Life Care Association, as most of you know, is a national organization. We have 9 regional chapters, and I am the president of the Mid-Atlantic chapter. Even though my practice has been open only 3 years, I knew immediately that ALCA was going to be a really important part of my journey as a care manager. And so I am thrilled to have this opportunity to be in this role and help to lead our chapter. ALCA, the Aging Life Care Association, really is the premier organization for the care management profession, and it serves a few really important functions. For members, for professional members, that ALCA designation is a major differentiator. Membership to this organization requires a certain level of education, of professional experience, and at the highest level of membership, credentialing. So it ensures that the people who are practicing as care managers, if they're ALCA members, then they really have demonstrated that they're prepared to do the scope of work that professional care managers need to do. The other piece, I think, for professional members that's really important is the support that you get both at the national and the local level. At the national level, there are opportunities to help advance the profession of care management through work. For example, Aging Life Care Association is working on putting together an outcomes study. They're looking at partnering with academic institutions to really demonstrate how aging life care managers can improve client outcomes. On that local level, you have access to continuing education, you have access to building business building tools or business growth tools. And then of course, just access to all of the other care managers in the region, the camaraderie and the collaboration that comes with that. I think the other thing that's really important about the Aging Life Care Association is for consumers. We have a published standard of practice and a code of ethics that really holds all of us to a certain standard with very rigorous requirements. And so that provides some assurance that when somebody hires an aging life care professional, they can expect a certain level of expertise and quality from that experience. I think, the last thing I want to say about ALCA, and thank you, Steve, for sharing this slide on membership, is that, really, if you're at the top of your field and you're a practicing care manager, or you're someone who is just dabbling or considering a career in care management, there is a place for you in this organization. We offer multiple levels of membership. There's mentorship programs available. And we're really looking at kind of increasing our diversity as a profession. Traditionally, there have been a lot of kind of nurses and social workers doing this work, but now we're seeing more people with different health and human services backgrounds coming in, occupational therapists. I hired a pharmacist in October. We're seeing recreational therapists. So if this is a career path that you think you might be interested in, I welcome your contact. You can contact me personally, and I'd be happy to hear about your career goals and talk through how an ALCA membership might support you in that.
Great. And with that, here, and I'm gonna, once you guys begin talking, I'll cut and paste the contact info into chat. But here we have the contacts for our panel members. So, I got a question before we kind of jump into the next segment, because let's say that I have a degree in recreational therapy and I'm really interested in becoming an aging life care manager. I need to, what are the steps for me to officially call myself a member of ALCA? Like, briefly, I believe you've got to get a certain amount of hours practicing as an aging life care manager.
So with that educational background, you could come in at the associate level, even without experience as a care manager, as long as you are working as a care manager. So, we see some solo practitioners. I mean, that's one of the really neat things about this organization, is that we have large practices that hire multiple care managers that have been open for decades. And then we have a lot of other practices that are just individuals, you know, who are getting started, or maybe individuals who have been in solo practice for a long time because that's what works for them. But if you have someone who can confirm, either a peer or an employer, that you are working in the field of care management and you have the educational background in health and human services, in something related to aging, then you can come in as an associate member. And I did forget to mention, Mid-Atlantic chapter is unique in that we do offer, I believe this year we're doing 2 student scholarships. So if you are a student or you know a student who is interested in a career in aging life care management, you can apply through our website and we will consider you for a scholarship for a membership so that you can attend the unit meetings and rub elbows with experienced care managers and learn more about the profession.
Cool. All right, great. Okay, so Donna, I guess let's we've got to know this awesome panel here, and now let's jump into the some words of wisdom from you all. And I have up on the screen the 8 knowledge areas of ALCA. Did somebody want to sort of tell us a little bit about this? And maybe this is a great way to kind of lead into discussion. And I'll just remind the audience that you guys can ask questions at any point in time during this program.
Ellen, would you tell us a little bit about the knowledge areas?
Go ahead, Heather, if you'd like to.
Oh, no, I was asking you.
Oh, okay. Yeah, so as far as the 8 core areas of expertise, these are the knowledge areas that we have as care managers. And it shows you how holistically we look at the person. We really work with the person. We're at the hub of the wheel where it says expertise. That's where the care manager is with the client, the individual receiving services, and sometimes the family. And we're working in all these different areas. We're not attorneys, but we do work in the legal field when we're making sure that they have their planning documents that they need, and we're linking them with attorneys who are going to be elder law experts who can help them with their documents. We look at health and disability. So we're not doctors, but we have a really good understanding of medicine and rehabilitation. In my case, I have a rehabilitation background. And we understand the clinical conditions and the chronic health conditions and medications, and we know who to link them with if they need an expert, a physician or somebody to help them. But we're coordinating the medical care and understanding where that is leading us in terms of coming up with a care plan to be able to support them. So for example, if they have diabetes, we want to make sure that we're monitoring the blood sugar levels and that they're able to do it, or there's a system in place to take care of that. So we're looking at all these different areas. What are their psychosocial supports? Are they living at home? Is it, does it need modification so that it's accessible for them? Or do they need a higher level of care where they're going to assisted living or skilled nursing or memory care, perhaps because of dementia or cognitive decline? So we're looking at where they are, their financial picture, because we want to come up with a plan that is sustainable, not only in terms of finances, but also in terms of what the family caregivers are able to provide or not. So we look at all of those different things. We link them with local resources. We may look into what kind of entitlements or benefits are available to support their care plan. And we're advocates for them. So if they end up in the emergency room, they have somebody who can be their voice if they're not able to. When you're not feeling well, it's really hard to be an advocate for yourself. And sometimes individuals or families just don't understand the systems that they find themselves working within. So we can help them navigate at a high level and really understand what it is that they need and how do we put that infrastructure in place to keep them well and moving forward. Are they safe? Are they as independent as they can possibly be, functioning as well as they can? And are they comfortable?
Great. This is great. And I like the 8 knowledge areas because it might provoke some thoughts or some ideas. Let's kind of just, I'm just curious for all of you, if you've got some insights that you could share with the audience that might help them with their loved ones. We have a lot of providers in the audience, help them with their clients. I know a lot of the people in the audience as providers, they're looking to partner with you and kind of understand the best way to do that. So I'll let you guys take it away.
Steve, I'd love to jump in for a minute if that's okay. And I just want to say that, you know, as you being the experts in aging well, as long as I've been in the industry, I would say that I don't think I could have done my job as well without the partnering that I've had with aging life care managers. Being in senior housing for so long, I can tell you that, you know, I work with a lot of aging life care managers and provide a lot of referrals to them because, especially I'll say over the last year with the pandemic, I am seeing families falling apart. You know, especially people who have some form of cognitive impairment or they're experiencing cognitive change, and the isolation has really caused them to go downhill quickly. And navigating senior living during this very precarious time has just put such a burden and a stress on families. And so, you know, when they come to me and they're looking at senior housing, oftentimes we'll put them in touch with someone like yourself. And then we also have a lot of aging life care managers working in our communities because our 2 Ingleside communities have a significant amount of independent living residents who are aging in place. Maybe they're not ready to move through the continuum. Maybe they want to stay where they are a little longer. Or like you were saying about advocacy, maybe they don't have somebody locally that can kind of help them with that, you know, kind of navigating what are all the options and the safest ones and, you know, how to get them through that process. So for me personally, and I know that I'm speaking about, you know, everybody here, I see there's people from, you know, home health, and I know that you interface with so many professionals who touch the lives of seniors. And I know that we're all we have the same goal in mind, is to help, you know, our aging families and their loved ones thrive, live their best life and find their best solution. So the thing that I found fascinating, I would love to ask if it's okay, is that, you know, I've been talking to a lot of care managers and they're seeing like different trends now with the pandemic. And I'm really curious, as a senior housing provider, obviously we saw our move-ins dip, and now we're hitting this really, you know, upward, you know, slope again where people are, you know, feeling more comfortable about making a move. But I'd love to get your thoughts on, like, how have things changed for you as aging life care managers? And what have you seen being sort of more of a significant trend now since you've been working with people through the pandemic?
Well, I can tell you for me and my practice, you know, facilitating communication has been a primary focus of what we've done. We've always been team builders and advocates, and, you know, managing communication is a big part of what we do in our daily work anyway. But since families have not been able to get into the communities, they're not able to get in sometimes into the hospitals when their loved ones are hospitalized, or into the rehab facilities. And meanwhile, all of our healthcare professionals and care staff in these communities are underwater, so they're less available to communicate. That's, you know, trying to come up with structured ways of making sure that families feel reassured and get the information that they need without, you know, becoming a pain in the neck to our partners that we're working with, has been a really interesting and unique challenge. And I think we've managed it pretty successfully, but that's something that I've spent a lot more time doing this year than I have in the past. Because usually we can mosey on into the communities, right, ladies, and get stuff done.
Yeah, I would have to agree. It was interesting. we expected some of our service time to dip, and of course it did because we couldn't make home visits, et cetera. But it was also amazing, or not amazing, but there was so much communication to just reassure people, and people who we generally kind of classify as stable, doing okay, maybe they're just a monthly visit. They really needed weekly communication just to thrive. So we've spent a lot of time engaging our clients as well. I mentioned that, quality is a big issue for all of us, is maintaining the quality of life of our clients. And I think the other piece of that we've kind of focused on is also those partnerships that you were referring to, Donna, because it is understanding what's important to the client, what's already working. And with the pandemic, we kind of had to remanufacture in some way some of those relationships.
Yeah.
To say, okay, well, we're thinking outside of the box to get this shot to this person, and now we have to make a double outside of the box to get back in. So those partnerships were really important for us to just keep our clients engaged and thriving.
That's great.
Yeah, we found that communication, same thing. You just need that communication with that care team or that care village. But we also found that we've had to think about doing what we've done so well in a different way. So whether it's, creating space outside that's warm and safe, and, I think all summer, you guys probably did this too, that all summer and all fall, we were meeting outdoors and still getting to see our clients. But it really depends on what's going on inside the buildings. If they have, positivity rates, then we can't go in or they can't come out. And so we have to be creative and figure out ways to work around that, whether it's, embracing technology or meeting outside or doing things differently than we originally did it, but we still, are relevant and be able to provide the services that we do, so we can make sure that they are getting the care that they need and just advocating for them overall.
Yeah.
Great.
It's wonderful.
No, the great question, Donna. And so now I'd love for you just to kind of hear what's on your mind. Like, here's my my vision for these monthly discussions is they're almost like that TV show, The View, where we just have a bunch of folks sitting around talking about what's going on in their life, and except for we're talking about what's going on in the world of aging life care and your individual practices. Is there anything out there, or like if you could, another thing is if you could give guidance to folks that are out there dealing with, a difficult caregiving situation, some words of wisdom.
I think for something that I'm really kind of is another trend or another theme right now is that now, kind of a year into this, I am seeing so much caregiver burnout now, when we have a primary caregiving spouse who has someone at home with a chronic illness, dementia, Parkinson's, something that really requires a lot of time and energy from that caregiving spouse. And, when Ellen talks about care planning, all of us care managers, we like to have our beautiful care plan, and we go in and we do our assessment and we've got our great plan. And, it's very much a living and working document, because you have to meet people where they are, and care management is usually pretty messy. So when I'm working with somebody with dementia or with Parkinson's, with another chronic illness, I'm really finding that I'm running parallel care plans. I need to have a care plan for the individual that I'm serving, but I also need to have a care plan for that caregiving spouse. And how do we make sure that they have access to support groups, that spouse really has a piece of technology they're comfortable using so that they can, use Zoom or use another platform to get the support that they need. How can we look at respite opportunities? Some families have been really resistant to going into communities, but things can get very unsafe at home, and so it's always this cost benefit analysis of what really is safe, and sometimes things at home can be way more unsafe than the potential risk of coming into a community. So it's really bringing together all of those resources to meet the whole family where they are, because there's always been an element of that, but now kind of more than ever, the impacts of this pandemic are really impacting entire family systems, not just the individual that we're there to manage.
We've had instances where we had to come up with that plan B for our client because the spouse ended up in the facility or in the hospital. So what's that plan B? Because they were the primary caregiver. And, if we're getting burnout with the caregivers, and in some cases, there was a shortage because a lot of them left the workforce because their children are at home with school, or they don't want to handle COVID positive patients. So, we're again kind of being creative and navigating it differently. But sometimes you have that care plan, and the best laid plans sometimes don't come to fruition because there's been a monkey wrench, and we got to come up with that plan B pretty quickly.
Right. Yeah, I like that term that you used, Heather, the living document, because it's almost like as soon as the care plan is quote unquote final, it's no longer final. So things just change because we're all human. One of the other things too, I think, and this is again providing support for both the families and their caregivers, is we've also have clients who have taken a look at their legal documents, their advance directives in particular, and just, rethinking through. And it, some of them are saying, oh, this is what that meant, and now I'm seeing that. No, I don't want that. And then others are saying the exact opposite. So a lot of it too has been kind of supporting both the client and the family to understand what this all means, and to help them evaluate the situations as they come up. I feel like in this job a lot, there's kind of, as we've said here, we take a few steps forward and we reevaluate, and sometimes we go back again. So it's kind of rejiggering what's happening and explaining and saying, you know what, this is the way we're going now. So it's been an interesting trend to see that.
Yeah, I've really also appreciated, those first few months were so difficult with rehab facilities and assisted living communities and home care companies. They were getting clobbered, trying to figure out how to, shift. And I really felt very strongly in the beginning that, the VDH was not coming through fast enough to support these communities. And it was such an inspiring thing to really watch these executive directors kind of get together and talk and solve a lot of their own problems. But now I'm seeing a lot of home care companies and communities coming up with some really creative and helpful plans to help alleviate family concerns, help make sure that we have access to our clients to assist with telehealth. That's kind of the bane of my existence lately, right? It was one thing getting people out to these appointments, but figuring out how we can help participate in those telehealth appointments. The communities that are working with us to help make that happen, I appreciate that so much.
So it looks like a question came in. I think you might have touched on it, but it looks like Mary Ellen, I hope I did not mispronouncing this, Mary Ellen Necht. Is that how you say that?
Yeah, from the medical team. Yeah.
Yeah. So she asked a question. Do you see clients and their families who live in the community interested in senior living at the same rate as pre-pandemic? Or have you seen them drop off in terms of interest level in moving to a community because of the pandemic? Be interesting to hear your perspective
Yeah,
on that.
well, I've said this all throughout the pandemic. The same things that happened to elders pre-pandemic are still happening, right?
Yep.
So we have moved people in again because it really was the safest and the best option for that family. Families who can wait, because we can make it safe at home, they have the financial resources. You know, I love live-in caregivers. It's been my absolute favorite way to do things during the pandemic, is to, you know, bring in a live-in caregiver. You've got less exposure risk, you've got continuity of care, you've got, you know, really seamless care. The caregivers like it too because they are having less exposure risk. So probably doing more of that. But yeah, I mean, people who need assisted living usually need it, at least by the time they come to us. What are you seeing, Christine?
I've seen both. I mean, at the beginning of the pandemic, I think it's changed from the beginning to the end, in that at the beginning, we had a lot of clients, you know, saying, we can't see, a lot of families saying, we can't see our loved ones, get them out of here. And then we had families, clients who were feeling that they, you know, the activities had stopped, the meals had stopped, and people were just scrambling. So we had quite a few that were saying, we want to move out. And again, to your point, Heather, for some of them, it was kind of just talking, reassuring this is the best fit. For others, a decision was made to move. So I think at the beginning, we saw kind of a drop off, and now I've seen a lot more people now, either the family caregiver has come to a moment where they can't have their loved one in their home anymore. They tried it for a few months, maybe even 9 months, 10 months. And now they're looking for another place. But there is a bit of shuffling around, you know, do we really want to be in a big community? Do we want to be in a smaller residential assisted living?
A lot of that's been a trend.
Yeah. So what have you seen up there, Ellen?
Same kind of stuff. At first, you know, people were saying, I want to move out, I want to go home, I want to be with my family. And at the time, a lot of family members were able to do it because they were working from home.
Yeah.
And it worked out for a while, but I think people are getting tired. And I think the level of care is increasing. Some people are declining either cognitively or physically, and now it's getting to be too much for family members. And we've had lots of people who ended up in the hospital for non-COVID related reasons. And, you know, they're not waiting, you know, strokes and heart attacks and things like that aren't waiting for the pandemic to be over. So they need to be navigated to the appropriate level of care. Right. So it really depends on what's happening in the building. And, you know, some are quarantining, some are not accepting, some are. And that's kind of one of the critical things with our job, is figuring out exactly what is happening in that community. Yep. And is it safe to move a client there? And then just helping with that transition very carefully from beginning to end.
Yeah, well, now the questions are coming through fast and furious. So this is awesome. This is but Mark Ash, always one to ask a good question. And Mark, I know that all the providers on this call are going to appreciate this question, is what do you look for in services that you choose to refer your clients to? Get a little insight on that. I mean, and you've thrown out, you know, hey, live-in care is really great. Just out of curiosity, do you all work exclusively with like one provider? Let's say it's live-in care, or do you, you know, work with a multitude? and how do people get on your radar in a meaningful way?
Well, I can say, you know, at least for us, we work with multiple providers because just like care managers, all of these individual companies have things that they're really great at. And, you know, in my role as a team builder, I want to connect my client with the company that is going to best serve their needs. You know, I can say for me, it's the 2 C's. It's communication and it's collaboration. So when I'm working with a home care company, I want to work with someone where I've got really streamlined communication. I don't want to go through 3 middle manager folks to get done what I need to get done. So that direct line of communication, and the companies I work with most often are the ones that have really perfected that.
Mhm.
And then the collaboration piece is so important. I don't want the home caregiver saying one thing and the company saying something else and I'm saying something else. That gets very stressful for families. So I really like us all to kind of be on the same page, to have a unified message to the family, and to make sure that that team that as a care manager I'm working so hard to build creates a, you know, as seamless a safety net as possible for that family. I want my home care company partner to be an extension of me when they're in that home. So that's what's important to me.
Right.
Great.
Yeah.
Great.
Sorry, Ellen, go ahead.
No, I was saying agreed. You know, I know exactly what you're saying, and with people who maybe aren't home care companies, but other ones, you know, there's no perfect facility. There's no perfect system for a family. It's trying to create the strongest, best one that you can. And it's that communication, that collaboration. It's also how they respond if there is an issue. You know, if there is a problem, and because as advocates, we sometimes need to have those difficult conversations, and it's how they respond to an issue, and being collaborative as part of that care team.
Right.
Mhm.
And that's exactly what I was going to say, Ellen, is the responsiveness. You know, I tend to think in my head, it's not if you've made a mistake, because all of us, we're all human. It's how you respond to that. The other piece that I wanted to add as well is that when I'm meeting a new client, or when my care managers are meeting a new client, we're seeing who's already involved. We're seeing what their likes and their dislikes are. So it's my role to make that support room, that team of collaboration, like Heather was talking about, stronger and fill in those gaps. So if somebody has a person in place or a company in place that I've never used, but they adore them, that person or that company are staying right there. Now, if it's later proven to me that that's not really the best fit, or there's some other question, then we're going to talk about other options. But I want what the client is comfortable with, what is best for them.
Great. Well, man, Donna, look at all these questions that are coming in. You want to take one, and if we're going to get through this, let's just jam through these as quickly as we can. Whoops.
You're
Oh,
muted.
unmute yourself. Unmute yourself. Sorry.
The word there, unmute yourself. Our next comes from an anonymous attendee. What is the range of cost for an initial care plan? What is the range of cost per year for your services?
I think that's super variable. I mean, my prices are on my website. That transparency piece for me is really, really important. You know, for me personally, I offer kind of a lower cost initial assessment because even I wanted to make care management services, excuse me, accessible to people who maybe could not afford ongoing care management. So I do a pretty affordable initial assessment, and folks get a written report so that if they can't continue to work with me, at least they have a game plan to start with. my assessments are $500 per individual, and then I have an hourly rate for folks who want to continue working with me. But I think there's a pretty broad spectrum, and that's the benefit of I always tell people, if you're going to hire a care manager, talk to 3. And sometimes when people call me, I give them 2 more to call. And ones that I actually think are good, because it's, you know, it's such an important relationship that you really, you want to feel comfortable with somebody's practice style and their communication style. And yeah, well, then I'm getting off track.
Oh, no, that's okay. But, you know, Christine, on that question about cost, is being a nonprofit, is there sort of a sliding scale that's associated with your organization? I know one of the groups that I want to get on one of our future discussions is ElderLink, which is run through Fairfax County government. But
yeah, so at Seabury, what we've tried to do as a nonprofit is to keep our care management rates affordable. We do have monies for subsidies in order to reduce that hourly rate for individuals, and that's for both our care management services as well as our life enrichment services. There are qualifications for that, and sometimes we have a short wait to that. But what Monica and I always try to do is take a look at the situation and see what's available. You know, is there a way to do this? Right now, we can't offer any of those subsidies over in Virginia, but in DC and Maryland, we do have some of those subsidy slots at times to offer. So thank you for bringing that up.
great. Let's see, trying to rip through these here. Cordell Martin, understanding that there appears to be a trend that hospitals and rehabs appear to be moving towards using paid referral groups to refer families for loved ones that cannot stay home. Are aging life care groups moving in the same direction? And if not, how does a senior community in this highly competitive environment get on your short list? Good question, Cordell.
Well, we are prohibited by our code of ethics for taking any kind of referral fees from any company. And that just ensures that we are delivering client-centered care without any bias. So that is not anything that is going to change for any ALCA member. And it's something that we're pretty proud of, I think, as an organization. You know, in terms of getting on, you know, my short list, be awesome at what you do. I mean, yes. Really, that's, you know, to me, it's the quality. It's, and I don't believe that there's any bad community. I hate it when people say, what's a good community? It depends on the person. It's all about the assessment. It's about finding the right place for the right person. And I'm always love to talk to people from communities, places where I don't have clients, to get to know communities better and what their strengths are and what you're great at.
Mm-hmm.
Great.
All right. Next question, Steve.
Yeah, go ahead. Just pick one out and we'll get through the list here.
Sure. From Jennifer Carnegie, she asks, for clients who need assisted living and are looking for a place to move from their home, do you find they prefer an assisted living community that requires the staff and residents be vaccinated versus the option to have the COVID vaccine?
I think it's heading that way.
Yeah.
We're lacking the availability right now, but you know, I'm hearing facilities, even though the healthcare company can't mandate that a caregiver be vaccinated, a facility can. You know, could say that in order for a home care company to be inside their building, they need to be vaccinated. So I think over time, as the availability of vaccines increase, we're going to be seeing that's not going to be a problem any longer. And I know that facilities are more welcoming to us, either having a negative COVID test and now getting vaccines.
And I just want to jump in quickly, because that is an area of kind of interest for me, is for caregiving professionals who are reluctant to getting vaccinated. If you are in a home care company and maybe a smaller home care company and you don't feel like you have kind of the resources to help provide your staff with really robust evidence-based information about the vaccine, please reach out to me. I'm happy to work with you on that. I'm pretty knowledgeable about the vaccines. I'm with the Medical Reserve Corps and I'm a volunteer vaccinator. And I really think that there's some barriers there that I'm really interested in helping the healthcare community overcome.
And that's great because you're this objective third party outside of the organization. So that's great. I really want to share Emily's question or comment with you because she is a caregiver. My parents are aging in place in Annapolis. They have a long-term care insurance policy that will probably be needed and accessed. We're totally over our heads with regard to that in terms of the minutia and the fine print of the long-term contract they have, plus the kind of record keeping that will be required to submit claims. Is this, well, she's saying, is this something that a daily money manager can help with? And I believe they can, but I'd love to hear your thoughts on long-term care insurance policies and helping families navigate what can be a lot of paperwork when you're talking about long-term care or Medicare, Medicaid, and those things.
And I think what we found to be successful is really just getting on the phone with the long-term care company and our clients and their families, depending upon who the decision makers are, and talking through some of that minutia. There's certainly the things that we've seen before, but I always feel like it's good to kind of go back. And then, of course, when we're making suggestions and recommendations about the services in place to be put in place, also talking with those providers about some of that as well. Do they take it? Have they done the record keeping? So a lot of that, and that's actually with all of the issues that come up with the different insurances and things.
Yeah, and part of our job is really to use the dollars that we have for their care most efficiently. So avoiding duplication and understanding what they do have available to them and using it in the best way.
Yeah, it takes some time up front, but usually once you get things set up with the long-term care policy, it rolls, and maybe a little bit of time, when they periodically reevaluate. But if you get it set up with the right home care company to begin with, it can make it less time consuming down the road.
This kind of stems into a comment that I saw from Catherine in chat, not in the Q&A box. And she's wondering, the crisis intervention seems to be the most common point when people reach out to not just you guys, but all of us. And she's wondering if there are new ways to reach families at risk prior to getting to an overwhelming situation. Have you guys had any luck with, getting those advanced planners on board? Great question, Catherine.
I mean, I think for me, that's something that we're always talking about when I go out to do kind of an initial assessment for people who are just trying to figure out all the puzzle pieces. And education, I think a lot of us participate in different ways in trying to educate the public about us being available. I like to tell people, if you carry your attorney's business card in your wallet, you should probably have our business card in your wallet. Yeah, that planning piece is hard. And yeah, home care companies that don't mind if I call them on the Sunday before Memorial Day, let me know, because that's always when things start. You have those urgent needs. Somebody's getting discharged from the hospital tomorrow and they need home care now.
Yeah.
Great. Donna, you want to take one of the remaining questions there as we try to wrap things up?
Sure. So Isabel is asking, how do aging life care managers recruit higher level personal assistants who can drive and take medical notes for the client?
I know for us, we have some entry-level positions, which are case management associates, care management associates. And they work, it's similar to what a paralegal would be to an attorney. So they're providing support services, but they don't have the full certification. They're doing that under a care manager certification and getting direction from the care manager and being a support role. So they may pick up some groceries and go see somebody at home to do a wellness visit and just make sure that they're okay. Or it might be taking them to the dentist or podiatrist or something, a lower level appointment, as opposed to primary care or neurology or something that might be a little bit more complex. So we do have a career path for people who are coming in as an assistant and eventually work their way up.
That's a great way to include them in, and a very important service as well. Well, it looks like we got our last question, but obviously whenever we say that, then more come in. But Galera, I'm never good at pronouncing your name. Do you provide power of attorney services as well in aging life care?
My practice does not. I have not dabbled in that, but I know that there are practices in our region who are very experienced at doing that. And I would recommend someone who's looking for that to work with a practice that has a lot of experience, because it's an enormous responsibility. Ellen, Christine, do you want to speak to that?
No, I was going to say the same thing, is that at our practice, we do not act as powers of attorney. But I know there are companies and individuals that do. And one of the things I always think about is how do you balance power of attorney and care management as well? So it's another consideration.
And we do provide it in certain instances. So we have nurses and social workers who will take on that role.
Yeah.
Do any of your practices, I was actually on a talk with another aging life care manager this morning, and she was talking about guardian services, where adult protective services would work with her to provide guardianship services. Do either or all of your practices do that?
We work with adult protective services, and we work with the guardians. Frequently, care managers are called upon by guardians of property or person, depending upon, Maryland, Virginia, or DC, they all call it by a different name, to act as a support or be that coordination person. And we frequently do that. We're frequently communicating with APS.
I talked to somebody last week, a care manager from one practice was going to serve as the power of attorney, and a different care management practice was actually going to manage the care. And that way they were avoiding conflict of interest. And I thought that was a great solution to work together to meet the needs of that client.
Mm-hmm.
We're currently doing quite a few arrangements like that. We do also work with maybe a court-appointed guardian. Sometimes we're asked to come in to oversee the care plan and make sure that the person that has been appointed guardian is looking at everything they need to look at to make sure that that person stays well. So we'll be asked to come in and do regular reports to the court.
Great. Whew. All right. Well, we went a few minutes over 1 o'clock, but I don't think this was a bad discussion for our first shot. What do you think, Donna?
No, I think it was excellent. Thank you so much.
So want to thank all the attendees and especially thank our panel members, and really looking forward to this as a continued series, and to just with the three of you, you can see the similarities and differences between your practices, And it'll be really interesting as we do this several times to learn about all the different providers in your field and the practices, and most importantly, fielding these great questions from the audience.
Mhm.
So,
Steve, do you have the lineup for next month?
oh, geez. Okay, we're gonna have to email that out.
Okay.
I know we got Susie Murphy, Kate Caldwell, and then I think we're gonna have another person from Pennsylvania. I was gonna reach out to Denise Valeria in your practice, Ellen, so that we can be spread throughout the Mid-Atlantic region again. But
That is a rock star lineup. I'm gonna go to that.
so great.
And
Well, I tell you, there was lots of your colleagues in the audience today, so I think this really is. It's a great way to just, for all of us to connect and think about things.
Absolutely. And April is full as well. So I hope that all of you will join us as we get to know all of our wonderful aging life care managers. And on behalf of a senior living provider, I just want to thank you guys so much, because you are a wonderful resource for me and for my clients. And you really help me do my job better so often. So anyway, thank you for joining us today. So
Thank you.
All right, guys, we'll see you next
All right.
time. See you tomorrow and Friday. Okay. See ya.
Yep.
Bye.